So here we can discuss the coagulation pathways. There are two main types of pathways, the extrinsic pathway and the extrinsic pathway, and there sometimes we call it the common pathway. So what happens actually that what is the difference between them? So intrinsic pathway, it's the internal damage to the blood vessels wall, such the plaque rupture, and extrinsic pathway, external trauma, as the name shows, external trauma or tissue damage. So this tissue damage results in the release of tissue factor from the damaged cells, which activate factor 7. Factor 7 is then activates the factor 10. The intrinsic pathway, as we know that intrinsic is internal damage to the blood vessel, such as the plaque rupture. So initiation, exposure of negatively charged surfaces such as collagen in the damaged blood vessel wall. So it activates the factor 12, Hedgeman factor, and then a series of reactions involving factor 12, factor 11 and factor 9, factor 8 and factor 10. So these are activated. Okay, and when these are activated, so we got at the end, for example, from the intrinsic pathway, from the extrinsic pathway, we get the activated factor 10, which joins the common pathway. So convergence, both the intrinsic and extrinsic pathway converge at the activation of the factor 10. So thrombin formation, factor 10A along with factor 5, calcium itself is a factor 4. So, and phospholipids activates prothrombin to form the thrombin, and fibrin formation, thrombin converts fibrinogen into fibrin, okay, which forms a mesh-like structure that traps platelets and blood cells, forming a blood clot. So this is how the blood clot is formed. And here you can say this is the on the right side is the contact activation intrinsic pathway and the tissue factor extrinsic pathway. So tissue, if you see at the right side, we have the damaged surface, so it activates the factor 12 into activated factor 12. Then it converts the factor 9, factor 11 into activated factor 11, and then the 9 into activated 9, and then the 10 in the presence of factor 8, activated factor 8, the 10 is converted into activated factor 10. On the other side, the tissue factor or extrinsic pathway activates the factor 7A, first the release of tissue factor occurs, which converts the factor 7 into activated factor 7, and then this converts factor 10 into activated factor 10. Then this factor 10, both these converge and give rise to the common pathway. What happens in common pathway? We have prothrombin, which is factor 2 actually. So this is converted into thrombin, activated factor 2 by the activated factor 10 and activated factor 5. So the thrombin then convert fibrinogen, which is factor 1, into activated factor fibrin, and the fibrin cross-linked fibrin clot, it traps the blood vessels, the different other factors, and they form a stable clot. And factor 13 is also activated by the activated factor 2, the thrombin. So the factor 13 does the stabilization of the clot. So factor 13A is clot stabilizing factor. From where comes the factor 5? So protein C and thrombomodulin, these combinedly in the presence of protein S, they activate protein C, and this protein C activates the factor 5 into activated factor 5. So these both factor 10A and factor 5A, they converts the prothrombin into thrombin A. So this is how the coagulation pathway works.